Abdominal incisions are a type of surgery that is performed in order to gain access to the abdominal cavity. This type of surgery is often performed in order to remove organs or tissue from the abdomen. There are a number of different techniques that can be used in order to make an abdominal incision, and the type of technique that is used will often depend on the specific reason for the surgery. Some of the most common reasons for abdominal incisions include appendectomy. This is a surgical procedure that is performed in order to remove the appendix. Cholecystectomy. This is a surgical procedure that is performed in order to remove the gallbladder. Colectomy. This is a surgical procedure that is performed in order to remove a portion of the colon. Although abdominal incisions are not uncommon, they can still be a source of worry for patients. Patients should be aware of the different types of abdominal incisions and the symptoms that may be associated with them. There are 4 main types of abdominal incisions. 1. Midline incisions. These incisions are made along the midline of the abdomen and are the most common type of incision. 2. Transverse incisions. These incisions are made across the abdomen and are usually used for patients who are obese or have a history of abdominal surgery. 3. Left-sided incisions. These incisions are made on the left side of the abdomen and are used for procedures that require access to the spleen or left kidney. 4. Right-sided incisions. These incisions are made on the right side of the abdomen and are used for procedures that require access to the liver or right kidney. Symptoms that may be associated with abdominal incisions include pain, swelling, redness, and drainage from the incision site. Patients. If you are facing abdominal incision symptoms, you are not alone. Many people suffer from this condition and there is no need to feel ashamed. Abdominal incisions is a medical condition that can be caused by a number of factors, such as surgery, infection, or trauma. The symptoms of abdominal incisions can vary from person to person, but the most common ones include pain, swelling, and redness around the incision site. There may also be a discharge of pus or blood from the incision. If you are experiencing any of these symptoms, it is important to see a doctor as soon as possible. Abdominal incisions can be a very painful experience. Oftentimes the pain can linger for weeks or even months. Traditional methods of treatment often involve the use of pain medication, which can have adverse side effects. Fortunately, there are a number of alternative methods of treatment that are available. These alternatives include the use of acupuncture, massage, and yoga. Each of these methods has been proven to be effective in the treatment of abdominal incisions.